Welcome. It is February 1st, 2024. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're getting ready to start a thoracic Deuk laser disc repair. The patient has multiple thoracic degenerated discs, and we looked at his MRI, and they've identified one disc in particular that has the most herniation. T6-T7. Everyone agree? T6-T7? And we're going to be attacking it from both sides to try to remove as much herniation as we can. All right, let's get started. So we're going to have to count ribs from top to bottom and bottom to top to get the right place. Let's get started. Thoracic disc herniations are very difficult to treat, but we always want to make sure we're treating the right level. So let's get started. All right, I can see at the bottom there we have 12. Yeah, but I don't see a pedicle of 12. So, do you think that's it? I'm just wondering, he's a bit kyphotic, so you may have to change the angle to accommodate the kyphosis. That's probably 12 shot. Not too much, small changes. That looks pretty good. So 12, 11, 10, 9, 8, 7, 6. Stay there, don't move. Shot. All right, so that's the disc right there. Right at there, right at there. All right, let's get started. Any way you can bring this fluoro towards the ceiling just a little bit. Are you ready, Dr. B? So the hardest part of this surgery is going to be the beginning, getting the needles into the thoracic spine. Once we have the needles in the right place, the rest of it should go very smoothly. But the first thing I have to do is place these needles. And you could use a small one. All right. I'm palpating the middle. I feel the spinous process. I'm going to come off to the side. We do want to try to get as far to the side as we can, because that's going to help us get more medial on the disc herniation. We're starting with the left side. Sats are good, everything's good. 100%. All right. Well, it looks like we're at the right disc. Let's just verify. 12, 11, 10, 9, 8, 7, 6. 6, 7, correct? Let's go lateral view. He is very thin. And because he's so thin, we don't have a lot of soft tissue to get through. You can see we've lost half a drop of blood. Shot. Of all the surgeries I do, DLDRs, this is the hardest. Thoracic is definitely the hardest. Shot. Shot. Yeah, the patient is taking a breath, that's why. All right, so shot. There's the facet shot. All right, so that's the disc I'm aiming for. Let's go AP again and just make sure that that is the right disc. You can see how irregular the end plates are, but this one and the one below are both irregular. So you can't really use that as your determining factor. He's got arthritis affecting every single disc. We're going to go from the neck down, from the cervical down. Shot. A little further north. Shot. That's good. Oh boy, he's a bit scoliotic. So there's, it looks like, hard to say, but yeah, there's T1, right? That's the first transverse process. So no, go to the pedicles. Don't count by, yeah. So T1, 2, 3, 4, 5, 6, 7. Henry, you get that? 6, 7.
Yes, we did.
So counting down and counting up, we're getting T6-7. So we use two different counting techniques, going from the top down, going from the bottom up. And they both confirm that we're at T6-7, which is where we're supposed to be. Let's go back to a lateral view. So we use the AP view primarily to verify the proper level. So we call that localization. And I use the lateral view mostly for the navigation. So localization, AP, navigation, primarily lateral. You notice we don't start as wide with the thoracic. Lay still, you're doing great. Shot. All right, that's probably fine. I'm going to have to come a little bit more lateral. Shot. I feel myself slipping around the facet, heading towards the disc. Shot. All right, we're almost there. Shot. Very good. I can kind of feel a herniation there. Shot. All right, we're at the back of the disc. We're about to enter the disc. Inside the disc. Perfect. That's absolutely perfect for the first one. Now we'll go number 2. Mini me. We got Big Papi and we got Mini me. So we got a long needle and a short needle. All right. Papi, Mini. Papi, Mini. Okay, same thing. We're going to basically target T6-7. And remember, he's got a little bit of scoliosis, so I just have to be a little careful here. There's the rib shot. Yeah. I need to start a little bit higher with this level. Let's do some num-num. I'm putting numbing medicine behind the spine in the fascia and soft tissues to make them feel better, so he doesn't have as much discomfort. Shot. Alrighty then, that's good. I need to aim a little bit more north. Any questions, Henry, from our audience? Shot.
Yes, we have a question from Canes25 on YouTube.
Yes, Canes 25. Shot.
They asked, sir, may I ask how the first patient is doing? You took a lot out of her and was a huge...
oh, she's doing great. I just checked on her before I came back. So Canes 25 asked, how is the cervical Deuk laser disc repair C5-6 right approach? She's awake, talking to me. She says her neck pain is gone. She said she has a sore throat. That's all, a sore throat. By the way, on orbit, we're off on orbit. Yeah, we're too lateral. Yeah, go back to a lateral view. Yeah, the first patient, her neck pain's gone, headache's gone, but she has a sore throat. That's all. And that's from the tube being down. So she's here with her mom. They're from Pittsburgh. And she's going to head back soon. Yep. All right, so we know we're too lateral. We need to be a little more medial. By the way, can you fix the orbit? You're off just a few degrees. Shot. That's probably better. I think we're off on WAG just a little bit, just a tiny, tiny bit. Maybe we're not. No, you know what? WAG is fine. Never mind. WAG is fine. I think it's his scoliosis. That's all. Yeah. So our first patient is doing quite well. Shot. She had a 0 pain score in her neck. Yeah, that's what I was just saying. Yeah, she had a tube down. Shot. So she's doing very well. Thanks for asking. Shot. All right. I got to get past this facet. Shot. Shot. Let's get an AP. I think I don't know about the orbit. What do you think? I mean, it's so hard to tell. It looks good below, but at that level above, it looks like it may be off a little bit, but I wouldn't change anything just yet. Jordan is doing a phenomenal job, Sean. We're alternating between AP and lateral. That's the problem. I'm a little bit too medial. I'm hitting the facet joint. I need to slip around that facet joint. I may want to restart just a little bit more lateral. Go ahead and go lateral. So picking your starting point here is very important. I started here, it didn't work, I was too lateral. I started here, too medial. I'm going to go a little bit, like split the difference and go between them. Just lay still. Yep. You're doing great. Everything's okay. You're going to feel a little discomfort. That's normal. All right. Shot. Shot. I'm really having a hard time seeing that. Shot. There. That's better. Let's get an AP. Again, because the spine is twisted, one side is higher than the other. Quick AP. Let's go north. Go, go. Shot. Back to a lateral. Thank you. Yeah. So I'm just a little bit medial. I want to be slightly more lateral, which is fine. If you want to err as you're, nobody's going to get it perfect. You have to figure it out as you do this. You have to start a little medial and work your way lateral. You're doing great. Just hang in there. We're going to have you asleep soon. I need you awake for the first part. Shot. Shot. Almost there. Shot. You doing okay? We're going to put you to sleep in a minute, but I need your help. AP. All right, we're almost done. We've already got one needle in place, and then we're getting the second one, okay? He's awake. I need his help. And then we're going to put him to sleep. Perfect. Perfect. Absolutely perfect. 12, 11, 10, 9, 8, 7, 6. 6, 7. Everyone agree? 6, 7. That's where we're supposed to be. That's where we are. By the way, you can't rely on the X-ray to tell you which disc is abnormal. You rely on the MRI for that. The X-ray just guides you to the proper location, and the starting point I pick. Are you comfy? You said yes. How long have you had back pain for?
1968.
Wow, folks, we may have a new record. 19, let me finish, 68. Do the math. 78, 88, 98, 2008, 2018. That's 50. Holy mackerel. He has had thoracic pain. Folks, this breaks my heart. For 55 years. I'm so sorry. Happened when?
1968.
Military?
Severe car accident.
Severe car accident. He had a motor vehicle accident. 1968. He's had this pain since then. He's just lived with it. Are you from New Mexico or California?
He's from West Virginia.
West Virginia. Shoot, I said Cali early. So he's from West Virginia. So let's hear it for West Virginia. Whoop, whoop. Huh?
Mountaineers.
Mountaineers. We have a lot of patients from West Virginia. Are you comfy? All right. So we've got this, we're in position. We've got the T6-7 disc accessed. Any pain? No pain. All right. Take 3 deep breaths. We're going to put you to sleep in a minute. I got to ask you a question first. How bad is that on a scale of 1 to 10?
Give us a number. 12.
12.
There you go.
Is that where you get your back pain? 12/10. Yes, it's concordant. Folks, that means that's his pain. We're going to fix it today. We got the right one. Congratulations, buddy. We got the right one. We're going to fix it for you. You get to go to sleep. When you wake up, we'll be done. This is great news. You know, whenever you're dealing with a painful disc, you got 12 of them in the thoracic spine. Which one, right? And sometimes it's easy because you look at the MRI and you can see which disc it is, but all the other ones are normal. And then you got one that's bad. And it happens to be right where you're doing the patient's pain is. Shot? Perfect. Take, count out loud for me from 1 to 100. Count out loud. Start from 1, count to 100 out loud. Good, keep going. The reason I have my patients count, folks, is that way I know when they go to sleep, because they stop counting. So what I was saying is this is great news. You have all these thoracic discs. You don't know which one it is for sure until you do the discogram, and then you find out. And we got the right one. I'm going to make a 4mm incision. You sure? Maybe you can do better than that. Huh? All right. Start with the 4mm incision. Okay, very good. So, huh? Yeah, I am. He's going to sleep, and while he's doing that, we're going to get in there and place our tube. Shot? You can see the guide wire. Show us the guide wire in the T6-7 disc there. You can see the guide wire. That guide wire, you don't want it to go too far forward. You don't want it to go any further forward than it is. It could go a little bit more, but there's no purpose. So that's as far forward as I want. Now, I'm going to run this dilator down over the guide wire. We may end up doing something different in a minute, but we'll see. Shot. All right, here we are. You can see the dilator tip is right there in the foramen, and we're now up against the back of the disc. I feel the herniation. Shot. I can feel the herniation. Oh yeah, wait. Here we go. Let's take out the guide wire. Shot. We're inside the disc. I don't know. I'm thinking lumbar. Let's see how this goes. Usually I save the cervical scope, the small scope, for the really collapsed disc. Now, also if they have bad osteoporosis. Any questions from our audience, Henry?
At this moment, no current questions.
That's amazing. You guys are watching history. Thoracic Deuk laser disc repair. No other doctor in the country would touch this patient. There's nobody. No one will touch this patient. They condemned him to live for 54 years with back pain. And we're going to get rid of it, 55 years. We're going to get rid of it today. That's the miracle of what we're doing. Curing pain. The future of spine surgery being done today at Deuk Spine Institute. And it's sad because he's fixable. All right. And it's pretty much bloodless surgery. You can see we've just got 2 drops of blood. That's it. Bloodless surgery, thoracic disc herniation, curing the back pain. He had 12 out of 10 concordant pain at T6-7. You guys got that? Any questions?
No current questions.
Everybody's too awestruck to ask a question, I'm sure.
Of course.
Anyway, let's run our video on why do herniated discs cause pain. Let's do the lumbar version.
Copy that.
Welcome back. Now you understand how people get so much pain from a disc herniation. It's all from inflammation. Inflammation within the posterior annular tear. That was discovered by me, the founder and CEO of Deuk Spine. I discovered it almost 18 years ago. And we've been trying to spread the word, share the information with other people so they don't have to live in pain anymore. This surgery cures the pain from a herniated disc. We've done an analysis of our Deuk laser disc repair patients, and the ones that have disc pain, that have the Deuk laser disc repair, the cure rate of their pain from the disc is 99.6%. 99.6%. That's basically 100%. That means if you have pain from a disc and we go in and do this procedure, it takes the pain away 99.6. Now, just to give you an idea of the opposition we're up against, I tried to publish that data recently at a meeting of neurosurgeons. And unfortunately, the companies that control the manufacture and sale of metal implants, spinal implants, they blocked that data from being presented at the meeting. It's the first of its kind data. They don't want the doctors hearing about it. They don't want surgeons hearing about it because they might change their mind and stop using the metal implants. So they've basically blocked access to knowledge and information. This is a total breakdown of the scientific process. To me, it's disgusting. That's why I've stopped trying to convince these people, because they're already bought and they're corrupted, and there's no uncorrupting them. The money is too good for these doctors, these surgeons, these companies, the reps. They just are making way too much money, and they don't care about patients. And the patient's doing well, they don't care. So instead, they just want to they want a receiver, a receptacle for their implants. The more they can stick in your body like a porcupine, the more money they make. Those are all pieces of herniation coming out.
Nice camera.
Yeah, it's a pretty good view for the cervical scope, right? The reason why the cervical scope doesn't afford as good a view as the lumbar, the cervical scope is fiber optic. The lumbar is rod lens. And I just use the word cervical and lumbar because that's what we mostly use them for. But for the thoracic spine, we could use either scope. But when the disc is pretty collapsed, we like to go with the smaller scope, which is what we're using. It's a fiber optic scope. Any questions?
At this moment, no current questions.
Amazing. Let's go ahead and show our audience how is it the Deuk laser disc repair does its magic. Okay, and with that video, you can now see how this procedure works. And really the miracle here is this patient has lived for 55 years with this pain, and we're literally going to get rid of it today. And I only wish that I had met him, 4 or 5 years ago when we started doing this procedure, thoracic, and I could have taken his pain away sooner, that's all. I said earlier he's from California, but he's actually from West Virginia. 55 years of pain from a car accident, 1968, right? I wasn't even born in 68. He must have been young himself.
I was a toddler.
You were a toddler in 68? You were a toddler until you were about 6 or 7, weren't you? Just kidding. All right. So far, everything is going very well. You see the laser fiber there? It's half a millimeter wide. So it gives you an idea of just how precise this tool is, the laser. Can we get a 4x4 there?
Yes, sir.
And what I'm doing is I'm gradually working my way out of the tear, out of the herniation. I'm pulling backwards. Henry, would you have either Lily or Cassie make me some fresh coffee, please?
Not a problem.
You can see the end plate right there to the right. I just zapped it. That is bone. It's not a bone spur. That's normal bone. It's called the end plate. It's the top of the vertebral body, or the bottom. All right. Any questions so far? All of these are pieces of herniation.
No current questions.
Unfortunately, they get stuck by scar tissue, and they make it hard to get them out. Thank you, Luis. By the way, when I was talking about this treatment, there is no other cure for thoracic pain from a herniated disc. You can try a fusion. Fusions, create lots of problems for people. Fusions don't even work that well. They end up causing more pain in the thoracic. So the fact that we have this treatment available for people like him who have thoracic pain that's severe, debilitating, they can't really live a normal life. He's done his best, but medicine had let him down until today. Now he's going to wake up without this pain, and he's going to be a new day for him, a new life. I was talking to a former patient who is trying to get his brother in to see us, and his brother has really bad neck pain, and his brother lives in a community, and his neighbor had a fusion done from a surgeon, and unfortunately he had that typical fusion, and then it led to another fusion, and then another fusion. 6 fusions later, he's now fused from C2 down to the sacrum. That's from his neck to his tailbone. These surgeons are just fusion crazy, people. Anyway, the patient's brother is in severe pain. He can't even do anything, can't move his head, move his neck, it hurts too much. But he's afraid to get surgery because of what his neighbor went through. Yeah. So my patient, and he's up in Pennsylvania, actually. I think he's Pennsylvania. Yeah. Anyway, he's trying to get his brother to at least get an evaluation. And his brother is just so scared He doesn't even want to do an evaluation. And I just feel horrible for these people, you know, that have been mistreated by the system over the years. And they have PTSD now from it. All right, we're just working our way out of the tear, backwards, cleaning it up as we go. We've done now 20 of these surgeries, maybe more, 22. Thoracic DLDRs. And every time we've done it, we've gotten rid of 99.5% of the pain. It's a cure to the discogenic pain. It's wonderful. All right. You can see all the scar tissue and calcium right there.
No current questions, but we do have a comment from Canes25 once more on YouTube
Yes, Gains 25.
saying, I can't imagine with all those bad discs the feeling when the patient says concordant. Great job.
Yeah, thank you. There's nothing better in the world to know that, you know, we're taking people out of pain. And like I said, 55 years this poor man has suffered. Anytime he's done anything physical, the pain comes. And it lays him up with spasms for days. And now that pain's going to be gone. It's just a pretty remarkable feeling, you know, to be part of that experience for people. You know, my dad was an OB-GYN, and he loved taking care of patients, loved delivering babies. But if you think about it, in a way, he was into pain management too, right? I mean, after all, when you're 9 months pregnant, man, you're in a lot of discomfort and pain. You just want to get that baby out. Huh? No, you can't live with an epidural. What I'm saying is, by the time a lot of women get to that ninth month, they're ready for that baby to come out. They want it out. Like, they're in pain. Their belly hurts, their back hurts, their hip hurts. You know, they're swollen up. They're just miserable. And, huh? Yeah. So my dad got them out of pain, right? Luis is nodding. He's like, yeah, you're right.
No, delivering the baby.
Delivering the baby, right? You're getting them out of pain. So we're delivering a baby right here. We're delivering a herniated disc baby. Getting our patient. Huh? No, not 9. This is a 55-year baby. It's not a 9 month. It's far worse. Let's try lumbar on the other side.
No problem. Yes, sir.
I have a feeling we would have been done 10 minutes ago if we had done lumbar. It's like popping a zit. Yeah, don't juice the laser right now. That would be really bad. Right? Can you imagine pumping 65 watts? Oh, is it 45? I thought we were higher than that. We really cut back, huh?
We have a question.
Sure.
This comes from Eric on YouTube.
Hi, Eric. Welcome to our live stream at Deuk Spine Institute.
They asked, Doc, are you within Humana's network?
Were we within Humana's network? I don't know. Well, we do take Humana. And just so you understand, all of our patients have to pay an out-of-pocket, okay, which you're probably used to, but ours can be a little bit higher, depending on your insurance. So my advice is get your MRI review done, and then just see. But listen, it's worth it to have this kind of surgery. You're not going to get it anywhere else. The doctors in Humana Network, they're just going to stick needles in you and do shots, or they're going to recommend stimulators, which they make a lot of money on putting in you. It's not going to work. You're going to go around with this battery pack and computer inside your body. You don't want that. There's a lot of inflammation right there. This is the best surgery in the world for pain. There's nothing better. Whatever it costs, get it done. Don't worry about the money. We'll fight your insurance with you. Try to get them to pay if they don't. Insurance is really bad these days about back pain. They don't want to pay. They don't want to pay for back pain. They want you people to suffer and take marijuana instead. They don't want to fix people. Insurance companies want to keep the money they get from you. They don't want to pay your bills. They're supposed to take the money from you and pay your bills. But these days they don't do that. They just keep the money. And at the end of the year, that's their profit, whatever they keep. So anytime they can get out of paying a bill, they're going to get out of paying a bill. All right, we're done. We got to go to the other side now. The spinal cord is literally right over there to the right. I mean, to 12 o'clock. That's it. Well, we cleaned out one side. Now, some people ask me, Dr. Deuk, are you getting the whole herniation? The answer is no. We cannot get the whole herniation. There's no surgery in the world that gets the whole herniation. Herniations are really difficult to get to. They're tiny, they're in like really deep and in very difficult to get to places. So we don't get the whole herniation. We usually get about 50% is our goal. So when you look at an MRI, you're not going to always see, oh, the herniation's completely gone. What we want to be gone is your symptoms. We don't judge our results based on your MRI. We judge our results based on you. Did we get you out of symptoms, out of pain? Done. I'm going to go to the other side. It's a little antibiotic. Here you go. Any questions?
No current questions, just a comment from Eric once more on YouTube saying, thank you. Medicaid usually pays for my copay.
Yeah, Medicaid will not pay for this surgery. I can tell you that. Medicaid will not pay. This surgery is not covered by Medicare or Medicaid. Sorry. You know, they just won't. They don't want to cover these new technologies. They only want to pay for the bad stuff, because most patients don't want the bad stuff. And that way they save money. These government payers, folks, they're not out there for your best interest, just so you know. They're out there to say that you're getting insurance, but not actually give you insurance. So the whole insurance system is set up to basically, yeah, we'll do the small one.
No. We have to know.
I know.
In case we need it. That's what I'm saying.
I want to do the cervical. Can you come over here? It went really well.
Oh, okay.
Yeah.
I want to change everything.
Oh, sorry. I'm not even paying attention. I'm just answering. Point is, folks, insurance companies, they want to be able to say, hey, we got you covered, but then they don't actually want to pay for anything. And their only reason they pay for anything is because you'd sue them if they didn't pay for anything. And they get really bad PR. So what they do is they selectively not pay for things they don't want to pay for that they know work. Because the more something works, the more people are going to want it. And the more people that want it means the more money they're going to pay. So they actually avoid paying for good procedures by just saying we don't cover it. They'll just call it experimental, because that's the only way that an insurance company can get out of paying for medical treatment, is to call it experimental. By calling it the treatment experimental, They are able to get out of paying by law. The law lets them get out of paying. Not by calling it experimental, but actually by proving that it's experimental. Now, if they call it experimental and they can't prove that it's experimental, then they can get in a lot of trouble, which is why artificial discs are now covered, because the insurance companies at first called them experimental. But then the manufacturers and the surgeons started saying, hey, they're not experimental. Experimental means you don't know what's going to happen. But we know what's going to happen. We're gonna fix the problem with it. Shot? So once you take the insurance company and you sue them and you go to court and you prove to a jury it's not experimental and the jury agrees, then the insurance company is going to have to pay for it. And that's the process they use nowadays to decide what to cover. They want to see, you know, how resolute are you at getting this procedure covered. So they deny everything. Anything new, they'll deny, even if it works. They don't care if it works. You could send them all the proof and evidence. It can be FDA approved. Hold on. You could prove beyond any doubt that it works, and they don't care. They just don't want to pay. Everything all right there? Yeah, we're almost done. We've got probably 10 minutes here. And the painful part is, for the most part, done. We're just doing the right side. We're almost finished. Remember, we're going transforaminal, which means we're going on the side of the spine. Shot. On the side of the spinal cord. Shot. Okay, we're at the back of the disc. I'm entering the disc. Shot. With the tube. The tube is now in the disc. Shot. All right, let's get the dilator out. We're going to be left with the tube, and we're going to do the surgery. Any other questions?
Yes, this next one comes from Bobby on YouTube. And they ask, what portions of UNHC PPO pay?
Yeah, great question. So United Healthcare PPO should pay 100%. And if we fight them on not paying, if they try not to pay and we fight them and we go to trial, we should win. The problem is it's expensive to go to trial. I was talking to our lawyers, and they said it cost them millions and millions of dollars to fight United Healthcare to get them to pay. Millions. They were mentioning numbers like $10 million for a lawsuit. I mean, that's how these insurance companies win, is because people don't have $10 million. Look at that. Look at all the redness there. That's inflammatory tissue, right? We've been talking about that. That's where the pain comes from. So we saw a lot of that on the right, not the left. So basically, the only way to get your insurance to pay if they deny it is to fight them. And the truth is, if you had access to a newspaper or a news channel, you can go on the news like ABC News and say, United Healthcare didn't pay for my surgery. So United Healthcare knows that you can do that. So guess what they do? They buy advertising in the media on Fox News or ABC News or NBC News or MSNBC. They buy a lot of advertising. And anytime somebody like you goes to to the media and says, oh, my insurance won't pay, guess what? We're not going to run a story on it. Why? Because United Healthcare is one of our biggest clients. They spend a ton of money advertising with us. So they won't run any bad PR for the insurance companies. They won't. So basically, you can't go to the media because they won't help you. And you go to your congressman and write letters. We've had 100 patients write letters to their congressman. And guess what happens? Nothing. You know why? Because the congressmen and senators are on the take from the insurance companies. United Healthcare funds their campaigns, whether directly or indirectly, okay, through some of their subsidiaries or some kind of, sneaky financing. In the end, they control the politicians. They control the lawmakers. They control the lobbyists. They control the media. And people like you who have paying money for your insurance, and suddenly you need this nice spine surgery and they don't want to pay for it. See, what happens is you have no outlet, you have no recourse except to pay for it yourself. And that's what our patients do for the most part. They pay in advance, and then we help them try to get the money from their insurance company. But here's the thing. The insurance companies are happy with that because they just keep denying it. And all you can do, in the end, the only thing you can do is sue them. And they know that a lawsuit will be $10 million. So are you going to sue United Healthcare and spend $10 million just to win $50,000? Nobody wants to do that. And that's the problem. They know that. And so they've got all these denials, and there's an old saying, divide and conquer, divide and conquer. They divide you, the patients, so you guys cannot work together. And the only way you can work together is through a class action lawsuit, through a lawyer, okay? So the chance of getting that happening is like $10 million, like I said. And they know that you don't have $10 million. You're not going to spend $10 million of your money to go get $50,000 for the surgery. These people have figured it out. They have the best lawyers. They have the best business people, MBAs. They hire them from Harvard. They're all corrupted. These Harvard MBAs work for United Healthcare, Blue Cross Blue Shield. They get paid gazillions of dollars, but still nothing compared to the profits that United Healthcare is making off of denying surgeries and treatments. United Healthcare posts $5 billion every 3 months, profit. They generate about $80 billion every 3 months. 80 billion. That's a B, folks, not an M. So United Healthcare is making $5 billion a quarter for every 3 months profit, while you don't get your surgery paid for. I had the same problem. I had United Healthcare. I had my sinuses operated on. They wouldn't pay. It was totally medically necessary. I couldn't even breathe. I was like literally going to die in my sleep from asphyxiation. I did a sleep study. I stopped breathing. I did a CT scan that showed everything was closed up. My septum was deviated. And my surgeon wanted to fix it. It was like $15,000, $20,000. And United Healthcare denied it, even though he submitted all the evidence. Okay? Why? Because there's no penalty for denying. There's no punishment. There's no negative. It's just reward. They get rewarded. They get to keep the money. And that's their profit at the end of the year. You see the problem? And this is a broken system, folks. When insurance companies' profits go up when they stop paying for your medical care, that is a broken system. The only way to fix it is to change the laws, which, by the way, your friendly politicians are working for the insurance companies, and they're the ones who make the laws. Good luck with that one. You guys are like literally a rat in a maze. When I say you guys, I mean myself. I had to pay for my sinus surgery. I had to pay out of my own pocket. I had to pay cash, even though I had insurance, good insurance from United Healthcare. It's wrong what they're doing, and I'm trying to expose it. But people don't want to hear about it. They just want to bitch and complain. Oh, Dr. Deuk, why isn't your surgery covered? Yeah, ask yourself that question. Why isn't it covered? That's your fault, buddy. Why don't you get your ass out there and go talk to your politician and tell your politicians that United Healthcare, Blue Cross, they shouldn't be able to deny surgery or any treatment for patients, right? So the solution is to have a committee, state by state, a committee that will review every denial and decide if it's justified or not. That's the solution. The problem is, as soon as you create a committee, United Healthcare will put people on that committee that will be getting money from United Healthcare, any other insurance. But that's the way to do it, okay? Or pay for it out of your own pocket. So I'm sorry, but we would definitely take all insurances. We would far more want to get money from the insurance company than from patients. Because after all, the insurance companies are supposed to be paying for this stuff. That's what they're there for. They're not there to be profitable. They're there to pay for your medical care. Right? I mean, isn't that what insurance is there for? To pay for your medical care? That's why you buy it. That's why you pay your premium every month, so they'll pay for your surgery. So yeah, when they misbehave and they don't pay, you have to hold them accountable. And you got to hold the politicians accountable. All right? That's the problem. The problem is people don't understand this, how it works. I'm teaching you how it works because I've been in the system now for 26 years. I've seen how sneaky they are, these insurance companies. And by the way, they're sneaky with everybody, not just Duke Spine. They try to get out of paying bills to everyone. We've got 5 minutes.
We have a couple more questions.
Listen, I'll be honest with you. I'm big on honesty. That's all I care about is honesty. I'd have no problem if the insurance companies posted on their website, we are a for-profit or non-profit company. We're here to make money, and we make money when you pay your premium, and we don't spend that money taking care of you. We get to keep every dollar that's not spent on your medical care. That's where our profit comes from. So we're going to try to do that. So you're going to sign up with us, and we're going to try to deny everything we can so that we can keep every dollar you paid us in premiums and be billionaires at the end of the year. If they said that to you, I'd have no problem with the insurance company. Because then they would be telling the truth. Okay, what bothers me is when they lie to you people and tell you guys that they're going to take care of you when you have a medical problem. Same thing's happening in the VA hospital. I worked at the VA hospital for 7 years. The busiest VA hospital in Florida, in Gainesville. Okay? And I see how the VA works. They do everything they can to not take care of the vets. Everything. We tried to see more patients to help the vets get out of pain. The VA system denied it. We tried to, we were only allowed to see 5 patients in the morning and 5 patients in the afternoon. And we're like, we could see 40 patients in the morning. There was a backlog of 6 months to be seen by neurosurgery at the VA. We went to the VA and said, we're only seeing 10 patients a day. We want to open the template up so we can see 30, 40 patients a day. And they said no. And they never gave us a reason, but the reason is obvious. It's because the more patients we see, the more MRIs we order, the more x-rays we order, the more surgeries we're going to recommend, and they don't want that. It's all about bottlenecking. It's all about rationing care. You guys hear about it, but it's true. It's been going on for years. So our vets go and put their lives on the line fighting in other countries for our businesses. So the big corporations and politicians can get rich. And when they come back with medical problems, what happens? They get denied treatment. And nobody ever says to the vets, oh, we're rationing care. Because if they said that, there would be an uproar. They lie to the vets. They say, oh, we don't have any more appointments for 6 months. Okay? We don't have enough doctors. Bullshit. The doctors are ready to see the patients. We want to help these vets. We basically work for free over there. And the VA is a cultural thing. It's a cultural problem. Okay? So insurance companies are doing the same thing. They actually run the VA. Humana runs the VA. Humana runs the VA. All the benefits, all the military benefits, TRICARE, Humana. Okay? Humana's been running the benefits for years, and all they do is deny, deny, deny. They slow down things. They have not enough doctors, not enough clinic spots. They do everything they can to keep the vets from getting medical care.
About 2 minutes?
Yeah. And, what bothers me, yes, that's a problem, but what bothers me the most is they lie to the vets and make it sound like they're doing everything they can when they're not. And they got tons of money, but they're spending it on Epic, electronic medical record system. The VA has spent over $10 billion on a medical record system that was basically a payoff, okay? There's no reason to have a $10 billion software program, and the person who sold it to the VA is like the richest person in America, or like in the top 10, all right, from all the profit they're making. And that money could have been spent on surgeries that are needed, knee replacements, hip replacements, spine surgeries, getting people out of pain. But instead, the veterans are marginalized. They're not given adequate care, and the money at the VA system is being diverted to ridiculous projects like buying a software program for $10 billion. By the way, the number came back that, oh, we were wrong on how much it's going to cost. It went from $5 billion, which is what they had contracted for, and now their projections are $50 billion. And it's a huge thing. Go look it up. They try to keep it out of the news. All right, almost done. I think I got a minute left. Yeah, this is the most painful area. So, all right, sorry. What other questions do you guys have?
Yes, this next one comes from SPV on YouTube.
Yep.
They ask, is this procedure the same as the PLDD?
No, this procedure is not the same as the PLDD. Not even close.
Next one comes from HJerpem on YouTube, asking, does the inflammation and scar tissue return requiring more surgery in the future?
That's a great question. You see what I'm doing right now? I'm removing the herniation. The herniation is what causes the inflammation. As long as this patient doesn't reherniate, there will be no return. So the goal is to keep the patient from reherniating while they heal. So the answer is no. The inflammation does not return.
Next question comes from John on YouTube, asking, assuming my insurance won't cover the procedure that I have recommended and I'm 100% sold on this in principle, and assuming I don't have access to liquid assets, what are my options?
So I don't know what you're saying, John. Are you saying you want the procedure, you don't have enough money?
I think I was in the assumption of that, yeah.
I don't know what to tell you. I can't solve all your problems, John. I can fix your back pain, your neck pain. I can pioneer the greatest spine surgery ever pioneered, but I mean, solving your financial problems, I just can't. I mean, I know what I would do. I'd do anything to get fixed so I don't have to live in pain, and I can avoid a fusion or another surgery that would be highly invasive and cause more problems for me. I would do anything. Knowing what I know about spine surgeons out there and what they do and how they screw people up so badly, I would avoid that type of surgery at all costs. How are we doing on irrigation? Yeah, I'm almost done. I'm just trying to find the end of the disc here. Not so easy. This looks like it could be it. Sorry, Berndes. I don't know what to tell you, my friend. But we don't do charity here, because charity at Deuk Spine means I'm paying out of my pocket for the surgery. I'm literally paying for it. And I can't pay for everybody's surgery. I mean, it's not how you run a business. We've got a huge overhead every month in the hundreds of thousands of dollars. And close to $1 million a month we have to pay. And I can't run this business with free care. We don't get any grants from the government. You know what I would say, John? This is what I would say. Contact Bill Gates, the richest man in the world, or what's his name? You know, Elon Musk. Send them a social media thing. Tell them, hey, I really need this surgery. Pay for it for me, please. I'll be forever in debt to you. That's what you need to do. You need to find somebody who's got a lot of money and ask them, because I'm not that guy. I don't have a lot of money. I put all my money back into this business to buy equipment, to pay my staff. I don't make a lot of money. I told somebody the other day I live in a 2,500 square foot home, and they couldn't believe it. They're like, there's no way. You must be living in a mansion somewhere. I'm like, no. You must have Ferraris and Lamborghinis. I said, no. I have one car. Well, it's not true. I do have a McLaren. But besides that, I don't. I have just one car. That's it. So That's not my goal in life, is to be one of those dudes with lots of cars and that kind of stuff. My goal is to fix people, but I can't do it for free. I need some help here. If your insurance won't pay, well, then you're going to have to pay. Well, I'm sorry here, Berndes. I'm a bit surprised there's more herniation than I originally expected. I think part of it is the smaller system we're using here, but we're making do. We're making do. Just about done.
John had a follow-up question asking, I guess what I'm asking is, do you have recommended finance options that patients have used through you?
We've had patients use something called Care Credit, and we're part of that Care Credit thing. Also, we've had Christian Care. They will cover the surgeries. Catholic Charities is a possibility. There's also, what do you call it? GoFundMe. I've told people to go check that out. I mean, there's a lot of possibilities, but I don't know if they're any good, you know. So, well, I'm just about done, and as I'm finishing, I'm finding, you know, more stuff. Here we go. Just about done here. This should be the last piece. Look how scarred up this piece of herniation is. All that yellow stuff is calcium. Shouldn't be there. It's only there because the body's inflammatory system put it there. It's an indication of severe chronic inflammation. Probably 30 seconds. I just want to look around the corner one more time. There we go. We're at the end of the disc. A little bit of inflammatory tissue right there. We're pretty much done. He's going to have a great result. You can see the fat. By the way, you don't get fat inside a disc. What's our next surgery? I know it's lumbar, but what, one level or something?
One level.
Our next surgery is lumbar. And we've done cervical, we've done thoracic, and now we have lumbar. And that's it for the day. One level with how much DPR? Wow. By the way, this laser fiber is 0.5 millimeter wide. It gives you some idea of how precise this surgery is. People worry about, oh, laser is going to cause problems. The laser doesn't cause problems. Surgeons cause problems. That's it. We're done. All right. The laser is the most precise surgical instrument we have. It's precise to 0.1 millimeter, a tenth of a millimeter. 0.1 millimeter. That's the precision. There is no other tool in medicine that has that precision, except for maybe DNA modification. What do they call it? Molecular biology, or these genetic treatments, right? That cut out segments of DNA. But this is, huh? Glue. Sure. You don't want to do steri strip?
We can do surgery.
Just
Can
do
I
a
have
steri
surgery
strip.
and one vein slip, please? Thank you.
Well, what are you worried about?
No staple, because he's gonna have a bone scan soon. And
No, just do a steri strip. Guys, look at this. Wait, where's my ruler? Can you see this, Henry?
Yes, we can.
Each incision is 4 millimeters. Okay? This is an outpatient procedure. Patients laying down. We literally lost 1 cc of blood. That's almost nothing. Thanks, everybody. Great job. Are there any other questions?
No current questions.
Let's run a nice testimonial, and then we'll end the stream, and we'll be back for lumbar.
Copy that.
Dr. Deuk Majin. I'm here with one of my patients and friends who I've known for years, and she has been suffering with back pain for, well, I'll let her tell you how long. And a week ago, she came and had the Deuk laser disc repair. She's here for a checkup, and I'll let her tell you how she's doing as well. So how long have you had your back pain for?
Started back in May last year, and I just couldn't get any relief from anyone. Finally, I asked you, and the rest is history. So this last week has been the best week of my life since May of 2022. So pain-free.
Excellent.
Yeah.
Now, I know it got bad last year, but did you have back pain on and off before that?
I did. I actually got thrown from a horse back in 2018 in Ireland. And that's what I think probably started it. I was having lower back pain, but never really did anything about it, just sort of lived with it.
Kind of modified your life, took
Yeah.
it easy, try to avoid things that aggravated the pain.
Exactly.
And now I know that you were suffering so badly before the surgery, and here you are with a smile on your face.
Oh yeah,
Yeah.
definitely.
Well, I'm so happy you're out of pain. You had the Deuk laser disc repair. You could actually see, we use a laser to clean the tear in the back of the disc where the pain comes from. The problem is most doctors don't know that's where the pain comes from, so they have no idea how to fix it. My years of doing endoscopic surgery taught me that that's exactly where the pain comes from. So it's a small little spot in the back of the disc. You fix that, the back pain goes away.
And it worked.
It's amazing.
It's like I told your wife, you're a miracle worker.
Oh, thank you very much. Is there anything you want to say to your fans out there?
I just highly recommend if you've had back pain in the past, don't live with it anymore. Call Dr. Deuk. He is the best.
Yeah, so many people's lives are just, quality of life is ruined by back pain.
It is, and not worth it. I'm ready to start traveling again, so.
Not too much too soon.
Not too soon, I know.
All right, very good, Jean. Great to see you.
Alrighty, thank you so much.
You're welcome.
I appreciate it.
Great to see you.
You too.